Tufan sir, shall we start?
Yes, we'll start. Please start.
So it's already 8 and we now welcome all of you to this 26th edition of Thursday Musings. Seshadri sir, next slide please. I welcome our chairperson, Professor Tufan Pati sir from Cuttack. Sir, not taking much time, I'll give you time to speak. Sir, please over to you. Take over the session.
Thank you. Thank you, Alim, for your kindness and shortening the time so that we have much more time for Dr. Seshadri to speak, and we'll have still more time to interact with him. I have with us two moderators who are the bright stars of Indian psychiatry, Dr. Amritpal Joshi from my place, who is Professor of Psychiatry in High-Tech Medical College, Dr. Alim Siddiqui from Lucknow, who is the Director of Healthy Minds and Neuropsychiatry. Both are IPS, direct members of IPS Executive Council, and they are brilliant, as you know. They have been brilliant in the first Silver Jubilee sessions of Thursday Musings, and they will be there like this up to the Platinum Jubilee. And now I have the opportunity to introduce our esteemed speakers. Dr. T.S. Satyanarayana Rao. He is known to everyone for many reasons and obvious reasons. He is remembered by everyone. His current designation is Professor and HOD Psychiatry, Department of JSS Medical College, Mysore. He had been the Honorary General Secretary of Indian Psychiatric Society now, editor of Journal of Psychosexual Health, formerly President of Indian Association of Geriatric Mental Health, former editor of Indian Journal of Psychiatry. He is Secretary of Psychiatry and Human Sexuality Section of WPA, editor, chairman of publications SASSM to IASSM. He is President of Carnatic Sexual Sciences Academy. Awards and donations including Markhatia 14, publication 309, book and book chapter 24. Such a brilliant, knowledgeable, erudite speaker, and we are privileged to have such a chairman with us, Dr. T.S. Satyanarayana Rao. And we have also with us Dr. Akhilesh Sharma. He is currently the Associate Professor of Department of Psychiatry, PGI, Chandigarh. He is a teacher of DM students in child psychiatry, which has started in PGI, MER. And his other special positions held are the Assistant Professor of Department of Psychiatry, UVAS, New Delhi, for some time. His research area is psychosomatic medicine and child psychiatry. He has 45 publications, 39 articles, and 2 book chapters, and received 4 awards. Welcome, Dr. Akhilesh, and thank you very much for coming and being here despite all the odds. Thank you. And with this, I hand over the meeting. The proceedings of this webinar to the chairpersons, Dr. Sharma and Dr. T.S. Rao. Over to you.
Good evening, everybody. At the outset, I'm really happy, along with Dr. Akhilesh, that this opportunity to be with Thursday Musings, very popular and something we look forward to. And I'm grateful to you for this opportunity. Of course, introduction of Dr. Shekhar Seshadri doesn't need it, but something formally has to be done, and Dr. Akhilesh will be doing it. Introducing this topic for all the people, child sexual abuse is one of the very taboo topic. And as a postgraduate student, I still remember Dr. Shekhar Seshadri speaking, and we were trying to occupy that frontline seats to see that what he's going to speak, and is very erudite and very topical presentations, something which I carry in my memory still. And as a PG, I remember almost maybe around 3 decades, we are talking quite significantly about issues of child sexual abuse. But when we started reading Freud, that seduction theory, that many of the people with neurosis, more particularly women, in fact, they have been sexually abused, and as one of the important cause, actually brings to the focus that this was actually somehow there for a long time. But as we are all well aware, nobody was trying to speak on this particular topic. I still remember Dr. Pratima Murthy is one of the paper presentations as child abuse, and very briefly speaking about child sexual abuse when I was postgraduate student, maybe immediately little after that. And As a postgraduate student, one of the paper what we used to read that comes the battered child syndrome. That time nobody used to talk much about sexual abuse could be happening. But then I still remember subsequently our culture actually very protective as far as this aspect is concerned. This is all problem of the Western countries. And more than anything else, the joint family system is actually most probably significantly protective. And what we basically call the awareness related to that lacking, somehow the whole topic was hidden and nobody used to talk about. And as an editor of Journal of Psychosexual Health, I very clearly remember reading the topic on adolescent sexual abuse and the various issues related to. And when we are trying to talk about child sexual abuse, 0 to 18, now that is actually the time duration what they give. And often when we try to look at the literature, it is about adolescents. But somehow the children not being mentioned, not being spoken, not being studied, and not possible. In fact, they don't have voice and all these type of things. And from that angle, the title, that narrative approaches, I think this is one of the extremely important component, and one should be looking forward to how actually to go about. Very often we talk about the girl child. I still remember another article by Dr. Vaijayanti about boys are neglected a lot, and there could be almost a lot of burning problems, more particularly the sexual abuse in case of boys too, as far as the Indian psychiatry is concerned. And coming to the current topic, we are all looking forward to, in fact, what Dr. Shekhar Seshadri, who has dedicated his life for this study of the problem, is something worthwhile to look into. And later as a chairman, again, I'll come back to and question and answers and conclusion comes actually. And I request Dr. Akhilesh to formally introduce Dr. Shekhar Seshadri.
Thank you, sir. Good evening, all. Though Dr. Shekhar Seshadri doesn't need any introduction, but it is customary. Dr. Shekhar Seshadri has done his graduation from Maulana Azad Medical College, Delhi, and he did his post-graduation from NIMHANS, Bangalore, where he is working as a senior professor in Department of Child and Adolescent Psychiatry. And he is also occupying the chair of Associate Dean in the same institute. His area of interest includes developmental disabilities and violence and trauma, abuse in children and adolescents, children who are in difficult circumstances, those who are in juvenile justice system. And he has worked with school programs, teacher training programs in life skills education. And he has worked with a lot of community and school mental health programs in India. He's a person most apt to speak on the topic which is going to talk about today. And I request, without wasting the time, to Professor Shekhar Seshadri to start with the presentation. Thank you.
Thank you very much. To begin with, thank you very much, Akhilesh. Thank you very much, Dr. Rao, for putting some kind of a context. And of course, thank you, Tufan Pati, Aleem Siddiqui, and Amrit Joshi for this initiative. Let me put some things in perspective. The importance of Thursday Musings really lies in the fact that in postgraduate psychiatry training, the emphasis given to psychotherapy varies across different centers. We all know that. And therefore, for a state branch to actually table the importance of therapeutic processes and then spread it across the network of people in clinical practice to really embrace the idea to go beyond diagnosis and prescription, to look at psychological and dynamic processes, I think is a fantastic initiative, and my salutes to the IP. May I request people to mute them? Thank you very much. The second point I wanted to make, taking over from what Dr. Rao said, see, when we speak of narrative therapy, the idea that comes to mind is immediately adult psychotherapy. The notion of narrative approaches to child psychotherapeutic interventions has not found much currency as far as our thinking is concerned. And this is what I wanted to present to you in terms of a very interesting presentation that I've tried to put together for the almost 263 people who've gathered here. I also wanted to say that a lot of the material that I'm going to speak about is put on a website, and some of the social media resources that I have put on chat for all of you to go into and spread the word of child mental health across the country. Having said that, let me quickly go to my slide share and talk to you about narrative approaches in child sexual abuse interventions as part of Thursday Musings. I have taken the liberty behind 21st January 2021 to put a little thing in Odia as well. I hope I've got it right. Amrit Patajoshi and Tofan Pati can tell me later if I've got the Odisha part of Thursday Musings right there. Now, let me introduce you first to what David Finkelhorst says as part of the traumagenic dynamics. This is very, very critical because I'm embedding the whole premise of narrative approaches in child sexual abuse interventions in a basic principle which I call as internal processes or internalization or inner voice. And I want to explain what this means. David Finkelhorst said that there are 4 basic processes under traumagenic dynamics. These are traumatic sexualization, the conditions in sexual abuse under which a child's sexuality is shaped in developmentally inappropriate and interpersonally dysfunctional ways. Stigmatization, which is the negative messages about the self that are communicated to the child. Betrayal, the child's immediate or delayed discovery that someone on whom they are virtually dependent has caused or wishes to cause them harm. And powerlessness, where the child's will, wishes, and sense of efficacy are repeatedly overruled and frustrated, and the child experiences the threat of injury or annihilation. Now, this is David Finkelhorst's traumagenic dynamic. But let's look at each of these in a little more detail, dividing them into processes, psychological impact, and the behavioral manifestations. This is exceedingly critical, my friends, because all of you would be surprised. Why is it that the same experience gives rise to later adolescent and adult outcomes on the one hand of sexual preoccupations and compulsive sexual behaviors, and on the other hand, avoidance or phobic reactions to sexual intimacy? Diametrically opposite behavioral outcomes to the same experience. And this happens if you look at the processes and the psychological impact. If a child is rewarded for sexual behaviors inappropriate to the developmental level, and the offender exchanges attention and affection for sex, there is increased salience of sexual issues and confusion on sexual matters, giving rise to this set of behaviors. On the other hand, if sexual activity is conditioned with negative emotions and memories, where the abuse is, let's say, coercive, traumatic in the form of injury, soft tissue injuries, bleeding injuries, hospitalizations, surgical interventions, and so on, you can see how there are negative associations to sexual activities and aversion to sexual intimacy, giving rise, therefore, to the whole dysfunction in adult relationship as well as in phobic avoidance. Part of this experience in early childhood is also to recognize that not all sexual abuse is necessarily traumatic in the form of hurt, because there is something known as the grooming process. And how, therefore, are the processes of traumatic sexualization internalized psychologically in these manners, thereby giving rise to the various ranges of behavioral manifestations that we see. Let's come next to stigmatization, where the processes are that the offender often blames or denigrates the victim. There is pressure on the child for secrecy. There is an inferring of attitudes of shame, and the victim is stereotyped as damaged goods, giving rise, therefore, to the internal phenomena of guilt and shame on the one hand, or a sense of differentness from others, and therefore isolation on the one hand, to self-cutting and suicidal behavior, suicidality on the other. So you can again see how yet another dimension of the traumagenic dynamics of David Finkelhor, which is stigmatization, has so many processes. Each of these processes gives rise to a certain inner psychological experience, and how that psychological experience in turn gives rise to a whole set of behavioral manifestations. Let's come to betrayal, where there's a manipulation of trust and vulnerability on the one hand. There is a disregarding of the child's well-being, but there's also a lack of support and protection from extended family and parents, and how this gives rise to grief and depression and extreme dependency on the one hand, and mistrust and anger and hostility on the other, and therefore the diametrically opposite behaviors of clinging vulnerability on the one hand, to isolation, to aggressive behavior and antisocial behaviors on the other. And finally, if you look at powerlessness, where there is an invasion of body territory against the child's wishes, an invasion that continues over time with the use of coercion and manipulation, and the child is unable to protect himself. Halt abuse, and there are repeated experiences of fear, and the child's tentative attempts at disclosure meet with failure because the child is unable to make others believe. Therefore, giving rise to anxiety and fear on the one hand, and a lower sense of efficacy, and a need to control and an identification with the aggressor on the other hand, and therefore the opposite manifestations of nightmares, phobias, and somatic complaints, dissociation, to aggressive behaviors and abusive behaviors in later adulthood. So these are David Finkelhor's traumagenic dynamics, and an expanded version of that, which again is not taught very often in postgraduate teaching. Having said that, just look at what an adult survivor says. It is very common for people to block out memories of extreme abuse only to have flashbacks later in life. It is a wonderful survival mechanism which helps us survive as children, but works against us when we are adults, because we cannot resolve what we do not know about. The abuse, I do remember, were treated as non-events by those in a position to help me. I never got the message that this behavior was something I could be enraged at. It was minimized, and many victims continue to minimize their abuse to their extreme detriment, often turning in on themselves, resulting in self-destructive behavior, including depression and, at worst, suicide. This, ladies and gentlemen, is what is called a narrative of an adult survivor. Let me then go and delve deeper into the issue of the inner voice and take one aspect of the extended narrative of child sexual abuse, which is death wish and suicidal intent. Let me introduce you to Firestone and speak a bit about suicidal individuals. Robert Firestone, who speaks about the concept of the inner voice or voice statements, says that if you look at levels of increasing suicidal ideation and thoughts that lead to low self-esteem or inwardness, these are called self-defeating thoughts. For example, self-depreciation thoughts of everyday life, such as you're incompetent, you're not attractive, you're going to make a fool of yourself.
Sir,
Yeah.
so the slides are actually quite blurred. They are not coming on well. So I think you should stop.
Was this also blurred?
Yes, sir. It is coming blurred. People are also putting comments there. This is also partially blurred, but the next one was totally blurred.
So can you stop share and share again?
Surely.
Yeah.
Is this better?
No, sir. It still is a blur.
Let me start from the beginning.
Yes, sir.
How does this look now?
And this slide is a little blurred somehow.
I have no idea what the issue is.
Pavan, what is the issue?
Sir, it looks like bandwidth is but sir, you are visible clearly.
Okay, let me persevere.
Yeah.
I do think that it could be a bandwidth problem.
Yeah.
And let's see whether it picks up. And
Yes.
so what Firestone says is that the identification of the suicidal individual.
How Pavan is your bandwidth?
Uh,
Can we share the slide from Pavan, sense if your bandwidth is okay, Pavan?
yes, sir. My bandwidth is fine, or that can be done. If
Okay. Then I will have to quickly email it to Pavan, which I can do so immediately. Just give me.
If you don't have any objection of sharing the slides.
Yes, 1 second. Not at all, not at all. Everything I do is copy left. I don't believe in copyright, so.
Pawan, be ready to share the slides and receive them.
So I have sent it, Pavan.
Yeah, Pavan will share it. Pavan will share it. 1 minute.
I'm just refreshing my mail.
Just let me know
I
if
think
it's
Dr.
reached,
Shekhar
and then I'll continue.
Seshadri is a great orator. Let him just continue. Slides can be shared later also.
Right.
Let us.
So the point, thank you very much, Dr. Rao. The point I was making is that the concept of the inner voice, as Firestone mentions, and he spoke particularly about suicidal intent, is how there are increasing levels of suicidal intent. And these increasing levels of suicidal intent have two levels. One is the cognition, and the other is the voice content or the voice statement that drives a person towards either cutting or self-harm behaviors. So, for example, self-deprecating statements which manifest as you're incompetent, or you'll make a fool of yourself, or you're no good, or statements that question one's self-worth, in the context of child sexual abuse, this whole business of being dirty, different, and damaged, which is internalized that since you're dirty, different, and damaged, what is the point in continuing in this different manner from what you were earlier? And how in increasing levels of suicidality, these voice statements keep making a difference to the way that a child, someone who has endured and experienced any form of abuse or trauma, actually internalizes this. And the point I'm trying to make, ladies and gentlemen, is that these internalizations are also internal narratives, which we need to keep in mind, because these internal narratives are the kind of statements that one needs to change when we use narrative approaches in the work with children. What I'm going to be demonstrating today are also simple methods of how we use artwork to actually make these narratives change in a child's mind. And this is basically my intention in demonstrating this. That any luck, Pawan? Excellent.
Yes, sir. I'll share it.
Lovely.
Is it visible clear, sir?
Yes,
Yeah.
it is.
You can go to full slide now. Yes, you can go to the next one. Next one. Thank you very much. So this is what I meant by saying that, go to the previous one, Pawan, very quickly. Yes. So if you look at levels of increasing suicidal ideation and look at number one, self-deprecating thoughts of everyday life, which is you're incompetent, to number five, which is self-content and vicious self-abusive thoughts, which is you idiot, you creep, you slut, you don't deserve anything, you're worthless. This is one level, which is thoughts that lead to low self-esteem and inward. The next is thoughts that support the cycle of addiction, which is a very common theme with adolescent and adult outcomes of child sexual abuse, which is thoughts urging the use of substances. It's okay to do drugs. You'll be more relaxed. Go ahead, have a drink. Or you weak-willed jerk, you're nothing but a drugged out drunken freak. Next, Pawan. Two thoughts that lead to suicide, which is self-annihilating thoughts. If you look at number seven, those that contribute to a self of hopelessness, see how bad you made your family feel by what you have gone through. Two, if you look at number nine, injunctions to inflict self-harm at an action level. Why don't you just cut yourself if you can't tolerate it? Two, number 11, injunctions to carry out suicide plans. You've thought about this long enough. Your life is over because you've been damaged. Just get it over with. All these are internal narratives that one needs to change. So this is the continuum of negative thought patterns which Firestone speaks about, and any combination of the voice attacks, these are attacks listed, can lead to serious suicidal intent. And this is what one needs to change, because these are thoughts that lead to isolation, about removing oneself from people's lives, which urge self-injury and a suicidal attempt. And these are all indications of high suicidal potential or risk. Next, Pawan. This brings me to the basis of developing therapeutic responses. And this is the most critical thing, the relationship between context, experience, inner voice, emotion, behavior. Pawan, can you play this video now? Ladies and gentlemen, just watch this video for the next 12 minutes.
Sir, video is not embedded. I'm unable to play it from my side. It is on your desktop. Hello, can you hear me, sir?
Okay.
Dr. Shekhar
Let
Seshadri,
me try and
please
see
from
whether I
your
can do it.
If
Dr.
you can
Shekhar?
share from your laptop, please, right?
Dr. Seshadri,
Your,
you can share it from your desktop because it has not come with the presentation.
Okay, let me try. Let me try. Business of young child and old child also. संक्षिप्त में मैं कहना चाहता हूं कि हर व्यवहार के पीछे, behind every behavior there is an emotion, behind every emotion there is an inner voice and thinking, behind every inner voice there is an experience, and behind every experience there's a context. Therefore, context begets experience, experience begets thoughts, inner processing, inner voice, antardhvani. अंतर्ध्वनि begets भावना and भावना begets व्यवहार. ये एक बेसिस है, ये ढांचा जो है, it is the basis for developing response and understanding the child's inner voice, because the behavior may be withdrawal, but the emotion can either be sadness or anger, and the inner voice is completely different, though the context and experience is the same. Sheila?
Yeah, this is actually the basis of almost all child work we do and child mental health work we do. We often look at behaviors because that's what we can see. व्यवहार जो है वो वही हमें दिखता है, वही टैंजिबल है. तो अक्सर हम बच्चों को बोलते हैं मत रो, चिंता मत करना, गुस्सा क्यों हो रहे हो, मत चिल्लाओ. So when we do that, we are only targeting the behaviors. And when we target behaviors in that way, we are not effective, because a behavior does not fall out of the sky. It comes from somewhere. There is a basis to it. And that is why when we give these responses, they are pointless when we say, don't do this or don't do that. So what, as Dr. Shekhar says, is what lies behind every behavior is an emotion. So behind behaviors like bedwetting, isolation, the child doesn't play with anybody, withdraws from other people, khana nahi kha raha hai, there are emotions of sadness or anxiety or worry or fear. If you take another example where children are, verbally abusive, hitting other children, those are behaviors. What is the emotion behind it? Usually it is anger or resentment. If you take a behavior like stealing, what is the emotion behind it? It is deprivation. It is the desire really for something, right? Behind every emotion, there is an inner voice. ये अंतर्ध्वनि क्या होता है? अंतर्ध्वनि very briefly and simply is हम सबके मन में एक अंतर्ध्वनि फिल्म जैसा सारा दिन चलता रहता है. Even if we don't articulate it, it is the voice in our minds. ये सेशन कब खत्म होगा, ये लोग संडे क्यों रखते हैं ये सेशन, आना पड़ता है सबको, 6 बज रहा है क्या, खाना क्या बनाऊं, shopping जाऊं क्या आज. These are our inner voices that are continually playing out. So we have some voices that play out continually like this, and others when we view a given situation. What are our inner voices about an experience that we had this morning? किसी को रोड पे देखा, एक एक्सीडेंट था, we saw a child begging, what, उसे कुछ दूं या ना दूं, उसको चाइल्ड केयर इंस्टीट्यूशन में रेफर करूं क्या, किसी को फोन करूं क्या, ऐसे नहीं होना चाहिए. These are inner voices. So how we view a situation and process our experiences is what inner voices are about. Where do these inner voices come from? An experience, as I said. And where does an experience come from? It comes from a context. So to give you a simple example, let's take a couple of examples actually before we close our discussion. Let's take the example of sexually abused child. Let's take 2 sexually abused children, both 16 years old, and use this framework and see how it could play out. The beauty of this framework is we could use it from left to right or right to left, and let me show you how. So if we take two 16-year-old girls, both of them are abused by a family member, let's say sexually abused, right? So the context is one in which, let's say it was child sexual abuse by a family member, to keep it simple. Yeah, there could be many other contextual issues depending on the characteristics of the family, etc. The experience is in all probability one that is difficult or traumatic. Okay, let's look at the inner voice of child A. One child, let's say, has voices, inner voices that say, why did he do this to me? Um, does this happen to all girls? Does this happen in all houses? I am dirty. It was my fault, right? I am responsible for this. Should I tell anybody? What will people think of me? Right? लोग क्या कहेंगे मेरे बारे में? फिर क्या होगा? मेरा फ्यूचर खराब हो जाएगा क्या? कोई मुझसे बात नहीं करेगा शायद. शायद कोई मुझसे शादी भी नहीं करेगा. ऐसे भी मैंने सुना है. Right? If you look at this set of inner voices, what would be the emotion that it would lead to? The primary emotion. I'm guessing that most of you are thinking anxiety. Yani ki chinta, anxiety, worry, right? And the behaviors for this child are likely to be withdrawing from everybody, किसी से बात नहीं करना, poor academic performance, क्योंकि class में जाती है तो she's not able to concentrate, क्योंकि सारा time यही बातें उसके मन में घूमती रहती हैं. This is anxiety processing. Okay. So, yes, somebody said avoidant behavior. So, yes, she probably avoids people, right? She particularly avoids that particular family member and so on. Let's take child 2. Same context, same experience. This child's inner voices, you know, the way she has processed and understood what has happened to her may be very different. वो सोच रही है कौन ये मेरे को ऐसे करने को? How does he have the right to do this? I hate him. Are all men like this? How dare they do things like this? So you see, the experience here is one of injustice, of anger, of resentment. So the emotion is anger, and the behavior, therefore, that people are seeing is, यार आजकल इससे बात भी नहीं कर सकते हैं, हर समय चिल्लाती है, चीजें लेकर फेंकती है, लोगों के साथ अक्सर लड़ाई करती है. So you see, two children who have the same context and experience can therefore have completely different emotional and behavioral issues because of this very critical middle piece. And the question for us when we are assessing a child is, हम हमेशा कल्पना करते हैं कि इस बच्चे के मन में अंतर्ध्वनि क्या हो सकता है, उस व्यवहार या बिहेवियर के पीछे क्या इमोशन है, क्या भावनाएं हैं, और ये भावनाएं किस तरह के अंतर्ध्वनि से आ रहे हैं. Why is this? If you look at this framework from an intervention perspective, this middle piece, ये अंतर्ध्वनि की बात जो है, सबसे क्रिटिकल है इंटरवेंशन के लिए. क्योंकि देखिए, जैसे मैंने कहा, बिहेवियर्स अगर हम बदलने के लिए कहें तो नो चाइल्ड इज गोइंग टू चेंज, मत करो वगैरह. सिमिलरली यू कांट चेंज इमोशंस बाय सेइंग डोंट बी सैड. अरे चिंता मत करो, गुस्सा होना गलत है. हाउ इफेक्टिव इज दैट? बट if you look on the left side, ये कॉन्टेक्स्ट और एक्सपीरियंस जो है, ये तो बीती हुई बातें हैं ना. जो हो गया वो सो हो गया. कुछ चेंजेस कर सकते हैं, बट primarily the incident in such cases has taken place. So the space and the window for our intervention and the target of our intervention when we work with a child, assessment के लिए, समझने के लिए और intervention के लिए, is the inner voice. If we change the inner voice of the child from I am dirty to he is dirty, it's my fault changes to it's his fault, it's not my fault, तब emotions बदलेंगे? Of course. Then the anxiety reduces. When the anxiety reduces and there's a change in emotions, then the behavior changes. So that is how we analyze using this framework in this direction. Let me give you an example. If we started the other way, आपके पास 4 बच्चे आते हैं, right? चारों बच्चों का anxiety है, right? All of them have anxiety issues. Their behaviors are all similar. Withdrawn है, खेलते नहीं है, खाना ठीक से नहीं खाते हैं, रात को nightmares हैं, okay, avoidant behavior है वगैरह. All 4 of them have anxiety behaviors, so the emotion is anxiety, right? Let's look now at the left extreme. आपने और inquiry की और आपको पता चला कि एक बच्चे का एंजाइटी का बेसिस है लर्निंग डिसेबिलिटी, मैथ्स में लर्निंग प्रॉब्लम्स है, और द चाइल्ड इज इन सिवियर डिस्ट्रेस बिकॉज द टीचर सेज यू नो एवरी डे देयर आर प्रॉब्लम्स इन स्कूल, यूजलेस हो, होमवर्क नहीं करके आते हो, सो द चाइल्ड इज रियली एंग्शियस एंड देयरफॉर दीज बिहेवियर्स. दूसरे बच्चे में यू रियलाइज कि this child comes from a situation of domestic violence and severe marital context, marital problems between the parents. And therefore, this child is really anxious and has started having these anxiety behaviors. तीसरे बच्चे में आपने देखा कि child sexual abuse का कुछ issues है. चौथा बच्चा में आपने देखा कि sexual abuse नहीं है, physical abuse है, right? पांचवा बच्चा में आपने देखा कि इसका सिवियर बुलिंग चल रहा है स्कूल में. So you see exactly the same behavior but completely different contexts. So you can, the beauty of this framework is exactly that. You can use it in either direction, and then you realize the implications it has for intervention. Because if you understand the contextual differences, if the behavior is the same, we can't have the same treatment for all 4 children with anxiety, right? We have to see what the context is. You know, a child with learning disability, we need school interventions. We need learning support. For the child with parental marital issues, we would have family level interventions and marital counseling, completely different interventions. Similarly, the first example I gave you, the behaviors are entirely different and the context could be the same. So to end our part of the discussion today, ladies and gentlemen, context matters. Children's inner voices matter. And here is how we construct and analyze and, you know, at a basic level, understand, you know, when people ask us, why do children behave the way they do? The next time you hear that, aap kalpana kijiye, you may know the 2 ends of this framework, and you really need to, the skill of all of us as childcare workers lies in how we construct and imagine the inner voice and use a framework like this to really understand why this child is where he or she is. So if
Business of young child and old child also. So this is basically the importance of the inner narrative. And I'm going to do to the last part of my presentation to really build on this thesis. And I will go to screen share again and quickly navigate the vicissitudes of technology. So, संक्षिप्त में मैं कहना चाहता हूं कि okay, let me see what is the best way that I can negotiate this. कि हर becoming व्यवहार के slide, I am पीछे move to the next one. So
in raw presentation, you can go to next slide and then you do screen share. You go to slide number 11 and then you do screen share. So it will skip the video.
Okay. So I go to raw presentation. Where is that?
So you must have it open in your, you want to go to slide number 11, na, sir?
Correct.
Yeah.
Actually,
Sir,
now Pawan can take it because
Pawan
there's no.
can take over, I think. Yeah.
I'll share it from my side.
Pavan, तुम कर लो 11 slides.
Thank you,
Slides
Pawan.
yeah.
Thank you. Technology ki jai ho. So, my gratitude to my colleague Sheila Ramaswamy, who's the technical and operational lead of SAMVAD, this project that we are implementing on child protection. Pawan, aage badhte raho. Right here. So this is exactly what I meant about internalization, that the experience of sexual abuse, depending on the developmental level, the temperament, attachment, gives an internalization or an internal view of the world as a result of the abuse, and based on the child characteristics and abuse status, gives rise to the child's behavior. So this is the thesis we presented. Next, Pawan. If we continue this, now internalizations differ in all abuse experiences, whether they are physical, emotional, or sexual. If it is sexual abuse by a close relative, and in extreme forms of sexual abuse. Next. Let's pay attention to all abuse experiences and look at the characteristic of all abuse experiences, which is intrusion. Chahe koi aapko mare, which is a physical intrusion, and the internalization is I am damaged, I am powerless, and the consequences, self-abuse, helplessness, aggressiveness. 2, threats. 2, acts of abuse with no protection, which gives rise to memories, which is why it gives rise to disturbed functioning, intrusive thoughts, flashbacks, and nightmares. Now, if you look at abuse which occurs in a closed format, Pawan, next. You look at the characteristics, which is an entanglement of love and want and hate and fear. I feel chaotic, extreme mood swings, to a juxtaposition of closeness and betrayal. So I'm betrayed by people close to me, and therefore the consequence that the person expects betrayal, and distorted family boundaries. I have no boundaries, and therefore distorted interacting with others. And when you look at sexual abuse, which is very sexual, and you look at the range of characteristics, which is sexualized behaviors with a lot of attention and sensual pleasures, and the internalization is that when I'm sexual, good things happen, and there are repeated sexualized behaviors. 2, distortions of reality, which is I have no emotions, no experience, no integrated self, and continued distortions. So this is the kind of format that one sees. Now, let's look at what Sheila presented. And for all those who are putting comments on the chat that there was some problem with the video, no problem. Please go to the YouTube link and subscribe to it. And the particular teaching session from which this 12-minute piece is extracted, the entire training video is there among all the videos which are there in our YouTube channel on our child protection project. So don't worry about it. You will be able to see it. It's a training program that we've done for the Ministry of Women and Child Development. And you can see the entire 2-hour training program, which is from where this 12-minute piece was extracted. So this is the kind of internalization model which forms part of the inner narrative and the scope for doing elegant and simple narrative work using narrative approaches with children. Next, Pawan. So here's what happens. Abuse causes confusion, gives rise to self-estrangement of self and relationship. Next, to poor survival skills. And from there next to entrapment. And from there to negative self-esteem. And from there next to further confusion. So this is the abuse cycle that takes place. Now, what is the inner voice? Pay attention to this. Confusion. The inner voice that is stuck at this stage can occur in 1 day, 1 week, or several years after abuse. And this is This stage shows how a child's internal narratives are structured. What is he doing to me? What is happening? I cannot understand this. Why is my body responding? Where can I be safe? How can I stop this? To self-estrangement, which is a lack of identity and decreased self-image and low self-esteem, causing fragmentation in the valuation of the self and inability to form positive relationship. What is the inner voice? I'm inadequate. I'm worthless. I'm dirty, odd, ugly, damaged, different. I don't deserve love. मैं हमेशा गलत हूं. Poor survival skills, जहां coping compromise हो जाता है. And what is the inner voice? मुझे अपने आप को छुपाना है. I must protect myself. Hypervigilance, dissociation. I cannot let others see who I really am. मैं हमेशा गलत हूं. To entrapment, बंदी हो जाना. I cannot change anything. I must keep this a secret. मैं responsible हूं. मैंने किसी को बताया नहीं. To negative self-image, which is the way we view ourselves and accept ourselves, and the inner voice at this stage is कि मैं बुरी हूं, मैं useless हूं. Now, to change from this abuse cycle to the exit cycle, here is the exit cycle. Next, Pavan. The abuse to the survivor cycle is you change confusion to clarity. You change self-estrangement to self-awareness. You change poor survival skills to good coping. You change entrapment to empowerment, and you change negative self-image to self-acceptance. Now, some examples of the narrative voices that the therapist will inculcate in the child are given here, but let's look at this in more detail. Next, Pavan. ये देखिए, clarity. What happened to me was abuse. He was responsible for this. It was not my fault. Self-awareness. I can make mistakes just like anyone else. I was not responsible for the abuse. Every time I make a mistake, it's not because of what happened to me then. I value myself. I'm a strong person. Good survivor skills. I can be myself to myself and others. I can make decisions. To empowerment. The abuse was not my fault. I did the best that I could at that time. I am remarkable for having survived. I have good qualities. I know myself. I'm strong. I like myself. And this method of moving from negative internal representations to positive internal representations is a gradual process. And this will lead to the child to learn about the self, to value the self, and to develop coping skills to manage life without the trauma of abuse. And this process of achieving this exit for a child can be achieved through direct verbal narrative approaches or through experiential methodologies. And this is where art and workbooks and theater and play are powerful tools to actually add to the narrative structure, changing the kind of internalization that structures. And what are these healing interventions that address negative self-concept and the specific questions and confusions that the child has? मुझे हुआ क्या? क्या सिर्फ मेरे साथ होता है? मेरे साथ कुछ गलत है? Was this a random or a planned event? Will I feel a certain way? Will others know about me? Should I be angry? It could have happened to anyone else, no? If you were not, someone else would have been victimized. Children are abused by these kind of people, and I'm angry with them. So you can also be. So this is how the narrative structures are changed, and you address questions like, will it happen again? Did I invite it? Is there something wrong with me? To give text to the kind of questions that the child has, to basically change the way that the child perceives the self and develops a future orientation which is more positive. And how does this happen? A very elegant structure of using the workbook method. What do you do in phase one? You establish rapport by getting to and get the child to know the self, getting the child to understand feelings, and getting the child to understand boundaries. Phase two, next. Exploration of trauma, developing trust and becoming safe, about secrets, about memories, nightmares, and monsters. Phase three, It's about repairing the sense of self, letting go of guilt and shame, and working through stuck feelings. And phase 4 is future oriented, things that I have learned. Now, how is this done? Let's examine how this is done. Pawan, next. ये देखिए, let's try it out. The therapist engages the child to say, let's draw a picture of yourself. And it's not just that the child does it and you're silent, but you're interactive to say, can I help you? Can I do the shading? Oh, long hair, short hair. What kind of a dress will you draw? If you don't want to draw, you don't feel like I can do it for you if you tell me what are the kind of stuff that you want to draw. Now, if you remember, I had said intent, content, methodology, and processing. Intent is to look at inner narratives. Content is to look at the self in phase 1. Methodology is drawing. Processing is, please describe what you have drawn. Is there anything missing here? Now, this is the simple way in which narrative approaches are done in child sexual abuse interventions. Next, we say, draw a happy face, a sad face, a scared face. Can you stick to the previous one, Pawan? Thank you very much. Uh, and we make these faces and then we process it by saying, I wonder why people are sad sometimes. I myself get scared when I have to go to exams. Let's complete sentences like I feel happy when, I feel sad when, I feel scared when. In the third part or a third session, as it were, draw a picture of yourself and color your personal space. What have you colored as your personal space? How did you decide that? What do you understand by personal space? Why is it personal? Our next. Draw your safe spaces. You can take a piece of paper which is divided into 4 spaces: the home, the neighborhood, the school, the city. Where do you find yourself safe? How is it safe there? What is safe there? What do you mean by safe spaces? So you can see how you're engaging the child in the child's narratives and the child's narratives of his or her ecology and the child's narratives of his or her internalizations and his or her feelings, going on to who can you share things with, even secrets. Let's do a list of that. Let's write the list of people. Is it easy to tell? Do you feel better when you're sharing? Let's draw a cartoon heroine who can help you. And a cartoon character, my friends, is a metaphor of heroism that is within each of us, including the children that you work with. And heroism within you will help you reduce bad memories. And as you proceed with this workbook and drawing format to really look at internalization narratives, feelings narratives, ecology narratives, and the abuse structure itself, you go to the next part, Pavan, which is complete these sentences. It was not my fault because I was not to blame because I could help myself this way. Help the child write a letter to the abuser and family. That's also a narrative. The abuser may not be there. The abuser may be an unknown person, a stranger, but you're still allowing the child to articulate feelings of anger that did not have a vent or a context for ventilation. And then draw a picture of yourself now. How have you changed? What are the things that you have learned? How have the internal thoughts that you have had earlier, how have they changed? And finally, Pawan, next, is to do identity exercises. And this is what the child needs to understand, that who I am is not equal to what happened to me. And what happened to me is only part of who I am. So let's look at who I am, what I am. And we ask the child to list, to draw the relationships that the child has as a son, a daughter, a nephew, a friend. the child's talents, interests. The child is a singer, the child can draw well, a good dancer, and what the child is good at. And these are the narrative processes through which there is reclamation of selfhood, reclamation of affirmative personhood, and healing from the trauma of child sexual abuses. Pawan, you can stop slide share. So this, ladies and gentlemen, is the framework for narrative approaches to child sexual abuse interventions. The special focus on internalization and inner voice as a concept of the inner narrative, and how that is so critical in understanding the relationship between manifest behaviors and consequences and the nature of abuse, and how, therefore, addressing this through elegant and simple means of the nature that I have demonstrated really forms the foundation of child sexual abuse interventions using narrative approaches. With that, I end the substance of my presentation. We have half an hour left. I see that a lot of stuff is coming in. A lot of this, like I said, is present in the materials that we have constantly been putting on chat. I noticed Amrit, Tofan Dada, and Alim, Janab Alim, that we had 350 live online, which is fantastic. I'm delighted to have shared these thoughts on behalf of my team itself. And I hand it over to you to basically moderate the next half an hour.
Thank you, sir. Thank you, sir. Actually, let me come out of the trance that you have put us in. So, 1 minute लगेगा आपने जो कर दिया उसको बाहर आने में. So thank you so much. Really absorbing. I was glued to the screen, and I think all of us learned many things. So I would invite the questions to be put in the chat box. Whatever questions you want to ask to sir, please put in the chat box. Sir, I think the phases that you said, that inner voice, I think that seems to be the most critical thing to act upon the context, experience, inner voice, emotion, and behavior. Is it so?
Yes.
It is the most subtle thing, or you can say the most fine tuning is to be done there only.
Absolutely, absolutely right. And this is the part that my colleague Sheila was also making, and I do notice that Tala Shamim has said, "Ma'am, your part was kind of missed due to poor connection, but you explained it beautifully." And this is a construct that we have worked on. So you're absolutely right. And in fact, this is the point that even Saloni Dang makes, Janab Alim, that in an attempt to change the inner voice to free the child of anxiety, could there also be a scenario where this could lead to the emergence of intense anger, changing the inner voice from "it's not my fault" to "it's his fault" to one who was assaulted? And how do we keep ourselves aware that that does not happen? And Saloni, I want to address this because this is a very critical issue, and I'll tell you why. I have worked with a lot of groups who engage in what is called as pastoral counseling. These are from various religious denominations. And a lot of people believe that forgiveness is quite a critical component in child sexual abuse healing. And I do not subscribe to that school of thought. You cannot harangue a child into forgiving the perpetrator.
Correct.
That's an absolutely wrong thing to do unless the child wants to do it. So I do not believe that forgiveness, and the child has every right to be angry. So there's a difference between anger and rage. And therefore, what does therapy mean? Therapy means providing a safe space for that anger to be ventilated. So should a child be allowed to actually suffer from the anxiety and the self-blame and the shame, or can it transform and proceed to anger and allow that to be resolved? And if the child then decides that I will forgive, that's a different issue that I need to get on with my life. So that's the reason why we provide narrative approaches to say, because the abuser may not be there, the abuser may be dead, the abuser may have gone away, the abuser may be unknown, which is why we allow for narrative work to be done. Right. Spew your anger, read it out to me. At least the experience of thinking it in the mind, putting pen to paper, reading it to the therapist, allowing the therapist to hear it, is having said 5 times what you never had the space to say. And all these are healing mechanisms. I also notice on chat something has been put on the kind of guilt that can take place in the grooming situation. And TG has put this on chat, the specific cognitive distortions and narratives that arise when a teenager has been groomed, and that too over a period of time. Exceedingly important interventions, TG. And I commend you for that, because you remember I had said that not all sexual abuse is coercive. And grooming is a very pernicious process by which a perpetrator deliberately establishes a relationship with a vulnerable child. And how do you establish the child is vulnerable? Because you know that every day when the child comes back from school, the door is locked. The whole mohalla knows ki iska baap peeta hai, and comes home drunk every night. And you befriend the child. There is inducement, there are gifts, you make the child feel special, dosti banate ho, aap kitne khas ho. And then you create secrecy, don't tell anyone that, we're going for a treat, and, you get all this excitement going. And then you sexualize the relationship. And then you either threaten the child, or you tell the child, if you disclose to someone, I'm finished and I'm pleading, for my safety, thereby making the child feel doubly responsible, not only to endure what has happened, but also to protect the safety of the perpetrator. Just see how complex and perverse and nuanced this kind of grooming is. And many people realize this much later of how you've been suckered, and the kind of distortions that take place is basically one of confusion. And this is precisely when I went through the abuse cycle. It first causes confusion because you don't know how to respond, particularly when the sexualization takes place. And it's very difficult sometimes, and it occurs to you much later that 2 years down the line, 5 years down the line, 10 years down the line, that the whole thing was a manipulation. And it's then that the anger comes in, and then one needs to do adult work. So that's the kind of stuff that we really keep in mind. Again, I want to represent not just to IPS Odisha, but to Alim and Amrit and Tufan Pati also, that I am again willing, like I did for the life skills session, for the entire chat to be saved and sent to me. And
Yes,
I'm
yes.
quite willing for my team to do a content analysis of that and come back for
We
another
were waiting for you to come back.
Definitely, sir. That we will do. I shall send you all the chats. As we had done last time, it will be more helpful.
Dr. TSS sir is one. Sir.
Okay, okay. I think while Alim is waiting for the other questions to come, I just want to know what is the earliest age these interventions were attempted, and if you have followed them up for a certain length of time. See, we all understand some of these things are etched so strongly in memory, or maybe even anatomically speaking. What is the real change with this or without this? Any such attempt has been made?
What a thoughtful question, Dr. Rao. Art-based work, and I must tell you that the youngest child in whom we have, shall I say, successfully used the workbook was 4 years old. And this was an intelligent child. So play work and paper pencil tasks can be used in preschoolers. And we've written about child sexual abuse dynamics in preschoolers, which is a particularly challenging area. But Of course, when it comes to 3 and 2, very difficult, because language skills, narrative skills are themselves not developed. Just as we often say, even in evidence gathering under POCSO, the minimum age of a child has to be 3 years old for meaningful evidence gathering, because child doesn't have narrative abilities, and we need to rely really on medical evidence that. But 4 and definitely 5 and 6, there is some narrative capacity that children have, and we have successfully used it for 5, 6 years old. There is an interesting question that actually is related to the issue that Dr. Rao has raised, which Sudeep Som has put about the approach to handle an adolescent or a young adult who's had history of CSA in childhood, and can we use the same approach? Interestingly, this workbook that I'm talking about, from which I've derived this, is a SAGE publication. SAGE has a series called the Interpersonal Violence Series. And the internalization that I had presented, which is the all abuse with close relatives and very sexual abuse, is from a book called Hearing the Internal Trauma by Sandra Wieland, part of this series. The workbook has 2 components. There's a workbook for children and there's a workbook for adolescents. It's a twin package. There's a workbook and there's the text. So there are 4 of them, 2 workbooks and 2 texts by Cheryl Karp and Tracy Butler, part of the Interpersonal Violence series of SAGE publication. So Sudeep, this can be used for adolescents. There is also something known as the Courage to Heal workbook, which can be used for adults. That's also available. It's a very powerful workbook that we use very effectively. And this is related to the kind of lifespan issue that Dr. Rao has actually introduced for the consideration of this August audience. And of course, Navonita, thank you very much for your compliments to say this.
I have one more case. See, this girl is somewhere around 10, 11 years, and from the school, her uncle used to take permission from the school, and it was actually a case of sexual abuse, which was very well documented. This particular girl, there are little sexualization related symptomatology there, but she's absolutely comfortable. She says, he used to call me, I used to go there, and what are precisely activities? In fact, she is very easy in narrating it also. Mother is little worried and anxious. See, now if a child knows all these things, and how actually you deal with this case of child? In fact, there are a few behaviors which are little sexualized, it looks like. In fact, she has been found to be interested more in the boys, and many other such comments and all people also have made.
Yeah. There are 2 aspects to the issue that Dr. Rao has raised in terms of intervention. And let me present these extremes. When I had first started my work on child sexual abuse, and I had done an interactive workshop cum survey methodology with young adults, and we had taken narratives. There was a particular narrative which is still fresh in my mind. This was a narrative of a 20-year-old who says, I recognize what happened to me at age 14 as abuse. I feel very strongly about abuse. I think the guy who did it, which was a relative, is a creep. I will never speak to him again. But perverse as it may sound, I have converted it into something positive. Why should I agonize about something when I was manipulated? Yes, it was my first sexual experience. I realized, and it was not coercive, it was manipulated. And she recognized it at age 20, but she says, I will not agonize about it. Why should I? That, which is one way of healing. To say, why should I take this shame and the blame onto myself? And so the whole shame and blame issue is a very gendered construct. And that's another narrative that we need to keep in mind. So this is one part of it. The second part is when children are sexualized and they get into a pattern of behavior, one then uses the methodology that I had introduced in the life skills method, where we have this window approach, Dr. Rao, and we speak about relationships, about health, about safety, about boundaries, about privacy, about consent, and then allow this particular child who may have been sexualized to understand then in which context do sexual behaviors become happy, healthy, safe, and responsible. So, what do relationships mean? And particularly with older children or adolescents, do we believe in the legitimacy of sexuality in the context of a socially sanctioned relationship, VIZ marriage? Do we believe in the legitimacy of sexuality in a committed, long-term, loving relationship, not necessarily married? Do we believe in the legitimacy of sexuality in a relationship which is committed? I've had relationships in the past, I may have in future. We don't know how long this will last, but it is loving, it is respectful. I'm okay with one night stands, but I know the person, there is chemistry, there is respect, or I don't care who it is, blindfold me. There is a whole range of sexuality ideologies embedded in a relationship ideology that we explore as we if a child is younger, let's say pre-adolescent, and has been sexualized, then we look at the health parameters, the privacy parameters, the safety parameters, the boundary parameters and the beauty of this approach is it doesn't matter whether you're 64 or whether you're 34 or whether you're 14. The same parameters hold. So that's the kind of approach that we really take. And to basically consolidate this and address some of the issues, Sharda Singh, for example, says, are there other ways and activities to relate with children if they are not good with drawings and not good interested in drawing and painting? Yes, narratives. और we say कि जिसके ऊपर आपका गुस्सा है और आप उससे कहना चाहते हो, आप कहो मैं लिखती हूं, मैं लिखता हूं, फिर मैं आपको पढ़ के सुनाता हूं या पढ़ के सुनाती हूं, तो फिर मन में जो भी टेंशन है वो बाहर आ जाएगा then. So these are narrative approaches which take a more role play and the use of theater techniques that, or we use play and we create narratives and stories using play materials, particularly for preschoolers or for the 6, 7, 8, 9, up to 10-year-olds. We can use play approaches that in case that. And I'd be very happy to share this PowerPoint. I will send it. I've already sent it to Pawan. Pawan, please send it freely. There is absolutely no problem. And the video part of it is available in the YouTube that
Yes.
I had shared that. Arushi Gandhi, of course, asks, can narrative therapy be used for other childhood disorders as well, such as ODD, conduct disorders? Absolutely. And in fact, if you go to our website, which we have also given in the chat, www.nimhanschildproject.in, you'll find a lot of stories that we have given for children with externalizing disorders to get them to be more reflective and give responses ki aise situation mein aap kya karoge, and to really build stories which look at empathy building and pro-social behaviors in our training sections and in our intervention sections that which is there that. And of course, Sabah Saifi says, if a child can't identify what is his or her inner voice, so what do we do? No, the child does not identify it. It is in this interaction that we identify it. We allow the child to say कि आप क्या उस वक्त आपको क्या लगा और आप क्या सोच रहे थे, आपको कैसा लगा, उसके बारे में कुछ बताएंगे, उसके बाद आपने क्या सोचा. That's the way we identify. So inner voices are identified through interactive processes, and the whole narrative approach and indeed narrative therapy is embedded in the fact that the therapist is a protagonist in the emerging story of the client. And I immerse myself and I insert myself in that emerging narrative, and particularly with children, using the what we call as empathy and the therapeutic uses of wonder. Ki, अच्छा फिर क्या हुआ और फिर आपने क्या सोचा और आपके मन में और क्या ख्याल थे? अच्छा, उसके बारे में और थोड़ा बताएंगे, so empathy and the therapeutic uses of wonder are exceedingly powerful. So yes, Shilpa Telgote, we can use this model in targeting child behaviors in other contexts also. And there are a lot of work going on in narrative therapy and training that is going on. I know that my good friend Jayaranjan Ram in the medical in Kolkata is doing a lot of work in training in collaboration with this pediatrician, the developmental pediatrician in Mumbai from Umeed, Vibha Krishnamurthy. They are doing a lot of simple training in narrative work. We would also be able to do this. Yes, Vigneshwaran, it is a therapy that can be used for adult survivor as well. Of course, there are some things on chat which is about guidelines regarding mandatory reporting on CSA and all that. All that is part of a POXO thing, but please do read some of the stuff in our website on mandatory reporting. We've got that. And messages coming galore, Amrit and Alim, Janab Alim, that, and like I said, I'd be happy if you could send it to me and,
Yeah, sure. That will
Yes,
be
sir.
fine.
We'll send, sir.
Sir,
We'll have another.
ये
we
बताइए,
would be.
can we use narrative therapy to win an election? The approach from narratives. If you are able to change the narratives,
Sorry, Alim, can you repeat that? Can you use narrative therapy for?
For winning an election, can we change the social fabric by the way of interventions of these narratives?
That is, you delete the word winning. For canvassing in the election, people resort to the some set of
Because I think
modified
everything
narratives.
that is being sold, some sort of narrative is spun around an axis. So from advertising to canvassing for elections to appearing in interview and to this narrative therapy. Sir, am I taking it too far or is it something like that?
No, in fact, I'm happy that you decided to take it that far, because let me link it to something that Megha Gupta has put on chat. When she says, how do we conclude these sessions? How do we collaboratively work in bringing a change in the inner voice so that the patient is not overwhelmed post the session? And what approach can we take when the patient is at risk of being overwhelmed and dissociating, taking it that far, Ali Janab Alim, that, Megha, one of the things is, and this is the importance of the therapist's voice also in the narrative work in the session. So the child is not overwhelmed when the child says, I felt that this happened to me. And, he said that it happened to me because I invited it, to say, no, that's a manipulation. And, actually, if it hadn't been you, others would have been targeted. These are people who target children. So the child feels, oh, so it is not something entirely wrong only with me. So in every session, one takes the effort in closure also to add narratives which brings to the child's consciousness and cognizance some things which is what I mentioned as part of the exit cycle. And that's how you prevent the child from being overwhelmed and the risk of dissociation. So I'm very happy, Megha Gupta, that you brought up that issue. And it's a very important issue to keep in mind in every session, that you always bring a kind of closure.
So there's an interesting question. What is the source of origin of the child's inner voice?
Things that the child has heard other people say, the child's basic intelligence and processing, things that you see and read on television, things that your friends tell you. But ultimately, as Sheila pointed out in the video, हम लोग सबके साथ होता है ना. You take an average experience. हम लोग सुबह सुबह निकलते हैं घर से और ट्रैफिक लाइट में खड़े हैं, कोई भिखारी आके भिक्षा मांग रहा है और आपके मन में कुछ सोच है, where does that सोच come from? It comes from past experience. It comes from what someone has told you कि मत देना. It comes from your own notion of suffering, and someone helped you, so your past experience is both good and positive. Or a very interesting piece that you read about poverty and about the situation of vulnerable people. It's about a TV program that you saw on begging on the streets. So these are all sources of where but there is also the individual agency that of the experiencing individual. Though partly for a child it comes from all these sources. Every human being, including every child, is making sense of the working model that a child has all these sources, but we still try to make sense of it through our own working and through the agency of our own conscious thinking mind. So there is that as well.
So should we
So
say
it,
that it is a
Alim, wait. Suppose there is a deaf and dumb child again. Again, corollary to this question. Not heard anything, not 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 experienced anything in the first time a child sexual abuse is occurring. Nobody has told him or her anything.
But the child has vision, and the child has perception, and the child has a conscious mind. The child may not be able to hear, but the child may not be able to speak. But the child can and that's where drawing comes in. And that's where body work comes in. That's where toys come in. And that's where demonstration comes in. That's where theater comes in. So the the inner voice is the difference between an internalization which occurs, Amrit, and it's a very interesting point you brought out, is the inner voice always internalized in language. You remember I said, not all child sexual abuse is internalized as language. It's internalized as sensations, as images. And that's where the inner voice is not necessarily words and sentences and narratives. So a narrative is not necessarily a sentence. A narrative is an image as well. As we say, an image speaks 1,000 words. So these are equally legitimate narratives. And that's the importance, therefore, particularly with the kind of child that you pointed out and with preschoolers, that we rely on images and then we build narratives on that basis.
Sir, if we loosen this definition slightly, so we can say there was a neural substrate. You were programmed in certain way by your genetics, and then your experiences, then your sensations and emotions, and all these चीजें सर जैसे हम personality formation बोलते हैं. So would it be reflective of something like that? Your neural substrate, your experiences, your whatever things you have learned, and based on that, your inner voice is formed.
Well, I will not dispute that hypothesis. I'm sure that there is a neural substrate to every conscious. It really depends on which end of the spectrum one wants to operate from. I'm sure there are the fMRI practitioners in our profession. I'm not one. I'm on this side. I'm on the side of experience. Everything has a substrate that we are, after all, that if you look at it in one sense. But many of us came into mental health and psychiatry because we believed that there is something in human consciousness and human experience that I suppose transcends the tangible. And in fact, I remember Dr. Neki saying once, the problem is when you try to make intangible experiences tangible, and the tangible interviewable, and the interviewable scoreable, then you reduce the evocativeness of human experience. And he was against this reductionist approach, that this is not in any way to belittle or trivialize the tremendous work that is being done in these kind of substrates, but I choose to look at the experiential end, and uh, the conscious experiential end of human endeavor and human endurance and human experience. I also see, Amrit, that there are exceedingly interesting questions on chat, some very, very complex issues that have come up, and it would be fantastic if you...
You want to take up a few?
Will you take some questions, or you will do it in the next another presentation?
I'll
take
do
up
it.
all the questions.
Yeah, I'll do the next one, because these are very, very complex, some of them, and it will give us the... And I could do it, as a joint session with my Samvad team. I'd like to thank my Samvad team for putting our links constantly. Please do subscribe to them, send it across to your networks. And thanks once again to my colleague Sheila, who explained the concept of the inner voice so elegantly in the video piece. So over to you.
Thank you so much, sir. Over to the chairperson, sir, for your concluding remarks. Akhilesh sir and P.S. sir.
Akhilesh, once Akhilesh speaks.
Thank you, sir. Thank you for such a nice presentation. And I think we have now a tool with a workbook type of thing from which the people can start working upon it to really help the clients. And I would like to say that language is the most important tool, but for those who are deprived of it, other forms of expressions do help. And at times, especially for younger children, a combination of these helps. They have to tell their story in any way. And the deprived one should be most helped with other ways, and we should be innovative in that. And with this, I conclude my remarks. Thank you, sir.
Of course, Dr. Shekhar Seshadri means almost always, whatever presentation, wonderful, inspiring, informative, and I think these are the terms many people have used already, and he has lived up to that remark. Dr. Shekhar Seshadri was really eye-opening. It was a good learning experience for, I think, every one of us. Personally, and on behalf of the co-chairperson, I thank this Thursday Musings team, Dr. Tofan Pati, Alim, and Amrit, for the wonderful opportunity they have given to us. Thank you very, very much.
Dr. Tofan, sir.
I'm extremely impressed. I had a lot of questions. Many of them had fed in the chat box, and I'm waiting for the next week. Otherwise, I can talk over with Dr. Seshadri personally, which I at times do. But this has been a fantastic eye-opening session, and we all look forward, because as I was impressed by the question put in by Alim, whether expanding this to election campaigning, not to election, winning election, this can be expanded to narrative modes in social matters for positioning of one statement. That will help, and that is indirectly election campaigning. We'll ask that questions and send it to Dr. Seshadri for discussion in meeting. All thanks, Dr. Seshadri, and I'm really thankful to Dr. Sharma for coming. I was informed that he's having some problem in family. His wife is ill. Still, he's here with us. I am thankful, personally thankful to Dr. Akhilesh Sharma and Dr. T.S.S. Rai, my good friend. He has to be here. He was there. Usko aana hi tha.
Thank you, sir.
And thanks, everybody.
Thank you. Good night. Sweet dreams. I think sexual abuse will forget. And
Sir, 1 minute. 1 minute. No, sir. Sir, one formal thank you from the IPS OSB. Sir, on behalf of the IPS Odisha State Branch. First of all, I would like to thank Dr. Shekhar Seshadri. He's such a nice man, such a humble man. You know, this topic he just invented this topic and then he told, yes, Amrit, I'm going to speak. Whatever you want, whenever you want, I'm always there. So he's our go-to man. He's like the Chatesar Pujara for us in Thursday Musings. You need him, he'll be there, blocking all balls and allowing us to hit. Thank you so much, sir, for making things simpler. And then we'll have, we'll take all the questions, a lot of questions. We'll take it to the next session. Thank you so much. Thank you, Akhilesh, sir, for coming all the way from Chandigarh, joining us from the cold weather of Chandigarh in spite of some family issues. Thank you, sir. TSS, sir, always the charming man, handsome, smiling. Thank you, sir. Thank you. So we'll have a lot of talk on sexual issues. Then we'll have you as a speaker, sir. Abhi garam nahi hai मामला,
Most
ठंड
welcome.
चल रहा है, sir. Thank you to Dr. Tufan, Dr. Alim, Sazia, Sharda, and Rucha. Thank you, IPS Odisha State Bank, for giving us a free hand to bat the way we want to. How many balls we take, how many sixes we hit.
Yesterday night we have made a abbreviation for Rucha, Sadia, and Sharda. That is RSS. Aliman
That's Alim was asking the narrative. Thank you, Pawan. Thank you, Pawan, for always being with us. Good night. Thank you so much. Catch you again next week. We have Dr. Ajit Bidde.
Thank you.
Colgate man will be speaking. It will be a new, interesting topic. Good night. Thank you so much.
Good night,
Good
sir.
night. Thank you. Thank you, Amrit.
Thank you so much. Thank you. Thank you, Shekhar, sir.
Right, Pawan?
Yes, sir. I'll close the meeting from my end, sir.
From our end, it won't be